All right. Well, we just want to thank everyone for joining us today. I was able to attach the agenda to the meeting invite earlier today. So we have several key areas that we'll be talking about and addressing several questions. RSM will be sharing some information with us around how, system design and best practices. Um, like I said, we are recording this. Jays and I will be watching the chat box. And so we will respond to any of those, depending on the volume of questions. We may respond in writing later, just depending on volume of questions and comments that come up. So with that, I will turn this over to Joey quickly.
Good afternoon, everybody. I hope you are all doing well. Thanks for joining us. I'm going to walk through just a little bit about our why to really help us set some foundation before we jump into some other components of the meeting. And so looking at some of the driving forces behind why we wanted a change in our IT system. And so as you know, we currently have multiple systems across our two waivers. The system previously used or for choices does not offer the level of functionality necessary for the updates that were made to the waiver, nor does it offer the level of transparency that we as a system really wanted to see. Our goal really was to create a new system that would be unified across the two waivers that would help to increase the effectiveness from the start of services to managing and monitoring services in both waivers across HCBS services. Again, we also wanted a system that would be South Dakota specific, something that could be flexible and be, outlined and based off what we need in our system. And so that was really start of what we were looking for, what changes we were hoping to bring into the system. And so the second piece of that is the goals from the IT system that really came based off stakeholder feedback. So we had spent some time reviewing areas that we wanted to see as a system. I would say the things that come to the top are creating again that unification, a unified case management system that would be comprehensive, person-centered, and a level of transparency in the system that we have never seen before. Again, we want a case management system that can be used very clearly for quality and compliance, and also have, again, that transparency piece. We did, if you guys recall, we followed the request for proposals or RFP process that was utilized to get to where we are today. That process requires a very thorough review and evaluation of all proposals that are submitted. There were 10 total proposals that were submitted for this RFP, and we ultimately chose to go with RSM through that process. The RFP was very clear around overall expectations, and that included things like document storage and generation, individual support planning, a needs analysis, service tracking, outcome tracking, incident reports and complaints, and then of course reporting. So those are all components that we requested as what we expected of this unified case management system. On June 12th of 2023, I sent out an email to the stakeholders, the provider systems, identifying that we had made a selection through the RFP process and we would be going forward with RSM. At that time, I also indicated a little bit about RSM and how the platform was based off Microsoft Dynamics, and that would bring a level of modernization to our system and workflows that we've never seen before. We also talked about through various stakeholder meetings, things that we could expect to see from this system. And that included things around service unit tracking, and case note reporting. And in the email that I sent on the 12th, I did talk about how those would be requirements of this system, as well as how this component of the system would integrate and communicate really clearly with the service authorization system. And so that's a little bit of the history, at least from the IT side, selection based off of goals and things we were looking for, as well as the process through the request for proposal or RFP before we started working with RSM. Julie, I'm guessing, or if we have questions, it'll come through at the end, or do we want to take a couple questions if anybody has them?
If there are any questions, we have a minute to take a couple. But I think it's fair to say if you have questions, put them in the chat and we'll kind of address them as we're able to.
That sounds great.
I did stop sharing because my presentation was covering up and I wasn't able to unmute, and I know my turn is next. So I'm just going to reshare here really quickly and hope that I can do what I need to do here. Okay, there we go. So, okay, so, I apologize. So just to give a few, and we don't have it necessarily a slide placeholder for this, but just to give kind of a recap. So as Joey talked about, some of the steps in the RFP and the vetting and the system goals for the IT system, we really want to kind of backtrack and just, we've been working with RSM for a couple years now. They have been, they started working with us when we first developed our intake tracking and system, even well before the front door to services went live. Last spring, around the same time, we were starting to work with them to build the service authorization system in preparation for the fee-for-service rate structure and choices waiver renewal. As you all know, in December, we went live with service change requests and those initial and annual authorizations, which is those annual authorizations are a change for our system in having those services renewed. As long as I've been with DDD, and probably well before that, we had not had expirations on service authorizations. And that is part of this fee-for-service structure and the service authorization system that's been built. So we've been using those automated processes now for a couple months. We have received some feedback on that, and we're working on following up on those separately. Also in December, we went live with several providers on the case note functionality, and that will be a main component of our focus for the time that we're spending together today. RSM, as I mentioned earlier, will be talking about kind of best practices, design, Dynamics 365, etc. We do want to just kind of say upfront that we have received the feedback from providers, and we are working on kind of a shift in approach. One of the things that we'll be talking about at the end of the meeting is the concept of pulling together a subcommittee to assist us with some of the design and feedback that we want to make sure is integrated, that we are designing a system that is effective and efficient for all users. So we'll be talking about that in a little bit more detail towards the end of the meeting. With that, I'm going to turn this over to Phil, who's going to give a little bit more background on RSM and the expertise that their team has.
Thanks, Julie, and welcome to today. So, well, just to give a quick overview, kind of our approach and where we come to and our engagement with DD so far in the adventure. First of all, we've kind of been in this for a while. I think one of the things that allowed us to be selected was really bringing what we call enterprise rigor to the approach. RSM is a pretty doggone big firm, and so in the consulting business and really our public sector stuff has really been focused primarily around developmental disabilities. That's where we have the most amount of depth. We do other things with other social services and case management, but really that's where we've done the lion's share of the work. And by doing it at the state and also some really large counties, it's given us this idea, an experience of delivery all the way to the last mile. We often see those providers in the counties and those actual distribution is the last mile. And when we get up to the state level, we really see more administration. And so being able to have both of those contexts has really allowed us to do a lot of really great things. And so along with our association with the NASD association, we've been doing that for 8 years or so, working on some of their projects with them together. And then also we're one of 2 or 3 people that are licensed on charting the life course methodology and implementing that into a system. So we've been working with Shelley Reynolds and crew for quite a while now, helping them innovate on how do we take the best practices from their methodology of case management and what does that mean to instantiate it into a computer system, into a delivery system. And so taking that human space and how do we get as much computer out of the way of the human space and still put enough computer in the way to automate. And so those have been challenges that we've been focused on for quite a long time now, and really have been bringing that expertise and bringing that experience of our team to the folks here. So part of the other thing about our team is it's a pretty tight group here within us. And so Eden and Tyson and myself and Lyle and some others have all been working together for kind of going on almost 10 years now, the whole group together. And so that's created a real expertise around it where we are kind of able to bounce ideas off each other and our other clients and really make sure we're bringing the best to each client. So one of the things that we want to talk a little bit about is how we do our solution. So Julie, if you could shoot to that next slide. And our approach is somewhat different in that we've done something that within our product we often talk about as an accelerator. And so what we do is we've taken the base product that is Microsoft Dynamics, and then what we've done is we've built a solution on top of it. If you think about what a spreadsheet is to Excel, it's the same type of thing. So you open up Excel and it just kind of looks at you and you load a spreadsheet and ta-da, it's magic, right? So we're kind of doing the same thing where we've taken the platform that Microsoft produces and they invest billions of dollars a year in this platform, and we get to take advantage of all of those advancements. And then what we've done is we've taken person-centered case management focus and configuration, and we put that into our system, and that's what we load. But that really gives us about 70% of the finished product, and we do that on purpose because there's so much variation between agencies across multiple states that really it's the last 30% that we really need to change to make it specific to an individual state or to an individual agency within a state. Things like how are the contracts between the agency and the providers? What is your billing processes? Those really, even though there's some Medicaid standards around those, there's a lot of variation into how they do that. And so although we built those up and we know how to do those, not everybody uses the exact same pieces. And so that's really our methodology for that. And so we often think about this as the analogy of building a house. So Julie, if you want to jump to that next one, the idea is when we're building this house is that we don't invite you over to the groundbreaking. Instead, what we do is we invite you into the house after we've leveled the ground, hooked up the sewer, hooked up the electricity, we've built the outside, we put the roof on it, we put the windows on it, and all that's left is pick up the flooring, the wall colors, and the appliances. Now that means that these houses look a little different depending on what you pick for flooring and appliances, right, and color your walls, but really the structure is the same. And so when we talk about those pieces, we really are talking about building on top of work that we've done at multiple states and that we've done in research with the NASD Association, with charting the life course. It's not just working with states and clients, it's also working with those industry experts on what are the methodologies and person-centered case management, what are the advancements that's happening in the Medicaid industry and social services, and how do we apply those to be, and what's kind of coming around the corner. We're trying to, in conversations to make sure we're looking forward and building out those specific pieces for what our clients need. And so along those lines is really where we get to kind of the entire solution that we have. And so Julie, if you want to jump to that next slide, when we talk about our solution, this is what it is basically in its entirety. Now here in South Dakota, we've we've implemented and partnered with you guys to implement the system in a phased approach. Some of our clients are like, hey, we're all paper right now and we need to go digital. So I want you to start and implement the whole shoot and match. So places like Hawaii, where we've taken intake, participant, all the way through case, service updates, quality, provider, case management, all of it in one shot. Other places where we've done parts of it like case management, service plans, and provider management. There's other places that are just asking for that quality or incident management. Here, our phased approach really has been bringing this on in phases. And in those phases, as Julie mentioned, consolidating some systems, as well as bringing up the level of participation and automation to specific standards that we want to do. But what's underneath all of it from day one, the very first day that we did intake, we dropped the whole shoot and match in there. The guts, the framework of the house was all there on day one. Maybe we only finished the front room, but we had the rest of the rooms ready to go. And now what we're doing is just finishing room by room by room as we go through the house. And so that's really what we've been doing here as a participation in that process. We're also doing the same thing at other places. And so our team is collaborating all the time together and all the time with the South Dakota team as well, saying, here's what we're learning over here, and there's some pieces over here. We're also one of Microsoft's largest Dynamics provider in the world, probably number 2 or 3. And so we are in Microsoft's back door. We sit with their product team and we get to hear about all the greatest things they have coming out. We get to influence and ask them for new features that they to bring to the world. And so in that process, we're also doing that advisement to South Dakota, saying and working with BIT and others to say, hey, within IT and within the technology that we have, what are some other advancements that we can look at? What are some pieces coming around the corner that we can do to make this more efficient? And so those are processes that we talk about all the time. And so to go into a little bit more about what specific things that we've done here, let's talk about some more specifics between clients, because I think what's important to say is that not only have we done it, but what does it look like at other clients? How are we comparing where we are with South Dakota with other ones? So Eden, do you want to kind of jump in here and take us through the next section?
Absolutely. And Julie, I was thinking maybe if I take control of the presenter here, if that would let me kind of do the click through.
Absolutely.
That way I don't have to. Let's see. Where is my? Okay. Let's see if that just works if I.
Is that working?
Oh, there we go. I think so. Let's see. I'm going to go back for a second and then. Okay, beautiful. Thank you. Hey, everybody. So I'm just going to highlight a couple things that I want to talk about really quick before I advance the slides. And so, I really want to just cover our case note design and methodology behind the architecture and why it's driven the way that is being built and what are the driving factors, right? And so, let's highlight a little bit about the reasons and benefits of case notes entry, what we're seeing out there, the minimum data requirements that are required for billing. I'll talk a little bit about the validation process with you guys. And then, as Phil mentioned here, we'll run through some of the other examples that we're seeing out there and kind of compare that to South Dakota's case note entry. As when we talk about the reasons and why case notes are required, right? So the number one thing is, right, case notes serve a way to ensure Medicaid funds are appropriately utilized, right? And the other part really that we want to highlight is the case note, the ability to enhance, really enhances that accountability and compliance, but also provides, we talked a little bit about transparency at the beginning of the call, provides that transparency across the entire state and the services being delivered. It ensures consistency and accuracy of data collection and reporting, right? And also it really helps measure and improve outcomes, right? It gives us some ability to evaluate the efficacy of the services being delivered. Okay, so when we think about our design approach and architecture, where we really, start to look back at, okay, what does Medicaid require us to submit when we actually get to billing? As we mentioned, we're rolling the system out into phases, and an upcoming release will include the billing component, where we actually can, where the providers and staff will be able to submit an 837 file. Now, when we look at an 837 file, and converting that schema into a human readable format, we see here that we've got about roughly 40, and this is the same across all states, right? And South Dakota is no exception. There's roughly 40 fields or so at the bare minimum that South Dakota MMIS needs us to submit for billing, right? And so, this can be essentially separated into multiple sections here. At the very top, so we've kind of divided it just so you guys can have a sense of what the data encompasses and what are the fields that we have to submit to Medicaid for billing in that 837 transaction. And this is really broken down into multiple sections. So we've got the provider details up on the left-hand side. Towards the middle section, we've got the participant details. And then we have all the different service delivered details, right? And so this is essentially, in a nutshell, what's I would say the very bare minimum. So not knowing that we have these fields that we have to submit on an 837, we architect the system in a way that isn't burdensome to the user. It doesn't make sense for a user to enter 40 fields every single day when notes are entered, right? So we will limit that to and build a process in a way that guides the users through a process where we can leverage static data that we've logged ahead of time. So, for example, we don't need to enter the participant details every single time. Their Medicaid, their birth, their address, right? We don't need to enter that every single time. We don't need to enter provider data every single time. Okay, and so if we look at this from a oops.
No, sorry, I inserted that. I just wanted to, so as we're kind of talking about the fields required by Medicaid, I'll just kind of interject here, Eden, if you want to go to the next slide. I just want to interject. So because all choices and family support providers are enrolled Medicaid providers, we do have billing and documentation requirements. We have a couple administrative rules listed here and a link to the provider billing manual. I just want to point out and reiterate that, we worked really closely with DSS, our state Medicaid agency, to make sure that we were creating and outlining the minimum requirements for service documentation that is acceptable to Medicaid. So, and also, as Eden is explaining, once we get to the point where we are automating billing from IRIS to Medicaid, this 837 file, the fields that he just shared, that's all the information that is required to be sent, but we are, pulling a lot of that from background processes. So then I'll kind of turn it back over to Eden to explain kind of what we designed based on their expertise and the system.
Yeah, thank you, Julie. Right, so talking about limiting burden, right? So far, South Dakota, in working with all the stakeholders, right? So we were able to get down to about, out of the 40, we really require 5 or 6, depending, right, if it's at that draft note or if the authorization exists, right? So if the authorization there, then we would select the authorization, and then we were able to, because we have the participant data, we have the provider data, we have all of that, we're able to capture that on behalf of the user and log all those details behind the scenes. So we really need to just worry about what are those unique encounters that happen on a daily basis that are not static, right? Or that maybe, when I say static, I'm talking about, the provider data that's there, the participant data, that does not change on a daily basis when we enter nodes. So it's really, what is the service that we render that day? what's the date and time, and we even went as far as had and calculate the units based on that. So, so really, we're able to meet that compliance by literally just going down to 5 or 6 fields on a case note, knowing that we've captured all of the other data that Medicaid requires behind the scenes, and we're all able to leverage that to the process as we guide the user through the process. So I'm just going to shift through, have several more slides to cover here. And so what does that look like for South Dakota? And as you guys are aware, right, you've been part of the feedback loop and providing feedback. So we're releasing regular enhancements to the system based on the collective feedback here. This is what it looks like today, right? We're going to have, as you guys have saw, we just recently released changes that allowed you to enter draft notes. But this is just an example that when I talk about those 5 or 6 fields, this is basically what a user would enter on that daily note that's being submitted. On the far right-hand side, there's a lot more data that needs to be captured from a compliance and transparency standpoint. But notice that we don't require users to enter that information, right? All of the details on the far right-hand side are system captured, right? We're not asking the user to double enter data when they, submit the note, when they create the note, when they, when the note is approved, right? We're able to have the system, because of the way the system we're able to leverage that foundation of the system and implement a lot of the workflow behind the scenes that actually allows us to just capture certain data elements without any user input, right? We just really need that bare minimum from the user to enter those daily notes in the service that's being rendered in date and time. And as I advance here, I did want to highlight just a little bit, there was a question about, could we see some examples, right? So when we talk about those bare minimum fields, so that's what Medicaid requires. And then each state has different requirements that they need to provide when they're doing reports to the federal government, or from advanced analytics and reporting, right? And so I haven't seen, from South Dakota, we're really just capturing the bare minimum that Medicaid requires. There isn't this additional data burden that we're collecting at this moment in time, right? And so, but I do want to highlight what we're seeing in some other states, because there are some other requirements that certain states have. Here, I have basically the same kind of concept that South Dakota has, where there is a progress note or a case note. Really, some states call them different names, so they use different language for these notes. In general, they're the same note. We've seen upwards of 30 additional fields being captured, and they're contextual depending on the service potentially, or the type of note that's being entered in the system. But I just want to kind of highlight that as another example, that this note here has about 30 fields that an end user would enter on any single day, potentially. And I said, as I mentioned, it's contextual depending on some of the services. Some services may require additional data to be collected versus some other fields. And so I kind of just want to highlight that, from another example from other states. And then, as I mentioned at the beginning of the call, so we have those data elements as a phased approach. We're the true source of all of the data that's going to go into the 837 into the Medicaid 837 transaction all stems and comes from the case note data, right? So we're able to capture the bulk of the data through the process. When a user enters the case note, that gets converted, and we automatically do this, as you guys that have used the system so far have recognized that we automatically create what we call the billable note as kind of that step one in the process that's going to drive all of the data that's going to generate the 837 to be a file to be able to bill to Medicaid and send the data to MMIS. So how do we avoid billing issues? How do we make sure that we are compliant in making sure that when we enter data in A37 file, that actually it's going to be accepted and not rejected. And somebody has to go and vet through all the details of why, what's wrong with the data, right? So, to avoid those issues, the system allows us to put some, stage gates and validation rules on the front end to avoid issues on the back end. And what I mean by that, so obviously we have the validation process ensuring that, we don't have major service overlaps and things like that, right? And so from experience, what we're seeing is if we put these billing validations on the front end to basically, in some regard, avoid human error, it has a major ROI on the back end where we've seen hours saved in trying to vet through claims data and rejected claims simply by just validating the data on the front end. Okay, and just kind of a little bit here, the process, it's basically a three-step process, right? So case note is entered into the system. The system, on behalf of the user, automatically creates the bill note, right? A user doesn't have to worry about that. So we capture all the necessary details as that step one that's going to drive the A37 file. Obviously, there's an approval process by the DSP supervisors. That's consistent from what I've seen from states, that there typically is and always is a approval process after a notice submitted. Is just another kind of stage gate and check to make sure that everything is accurate and that it's being reported correctly. And typically there's an attestation from both the individual that logs the note and then the attestation from the supervisor that they've officially blessed the data that's there and they're hitting that approve button. And so that's basically from that three-step process. That's typically where we see elsewhere. Let's see if I can advance here. Okay, so I think Tyson, I think this one is you. I think you're up next.
Yep, definitely. Thanks, Eden. Hey, everyone. So since we've gone live, we've definitely gotten a lot of great feedback in terms of the system, how it works, and enhancements, right? Like things that we'd like to see going forward. And so just to give you kind of a sneak peek at what is coming, we broke it down into 4 different categories: billable notes, case notes, service requests, and authorizations, and then more so like lumping provider functionality together. So billable notes, some of the feedback that more so stood out to us. And as you look at this list, it's by no means everything, right? These are more so like the broader categories. So if you see one, it could be 3 or 4 things that make it up, right? In terms of enhancing the overall functionality. And so billable notes, we're going to be developing a way basically for you to see your billable note and then every case note that applies to it directly underneath it. So it'll look like kind of a parent-child view. And from there, you'll be able to validate those billable notes directly from that page, right? But you don't have to dive into it to see the details. Outside of that, we're going to be updating the export view. So changing up some of the columns that you kick out when you do export your billable notes to Excel. I think there's a service description that's going to be in there just so that you don't have to go look up what T2016 means in a spreadsheet or a PDF document. The hours authorized for the week and return process billable notes. The hours per week is more so like how many hours you are authorized on a weekly basis, right? So being able to kind of see where you're at on a 7-day period, I think, and then returning the process billable notes. Once you get to a certain point in the process, being able to just send it back so that additional notes can be added into it. As a side note, anytime you see those little stars, the asterisks next to it, it indicates that we need a little bit more feedback, right? Because we want to make sure that we're building what meets your needs. South Dakota's needs, the case managers, the CSPs. We want to make sure that we're not building in a vacuum, right? So more to come on that, but it's going to need some of your input. In terms of case note functionality, basically we're going to be giving supervisors a few new views to kind of start to see more of the data in an easier to digest manner, potentially adding some color coding to the system to help get some of those red alerts to kind of stand out to you guys. Similar to what we have for billable notes, we're going to be allowing you to export case notes to Excel, right? To kind of, I think, more easily jump through them, do some quick math in terms of total units and whatnot. And then the process for case notes without service authorizations, we're looking to change this a little bit. Some of the feedback that we've gotten is that we want the ability to basically change the service authorization that we selected on a note. So maybe I clicked group home and it should have been facility-based A or something along those lines, being able to just switch those values so that you don't have to delete the note and restart. So that's one thing that we're looking into. And then lastly, overlapping case notes for supported employment and individual supported employment. Yeah, this is another one that we flagged for a little bit of follow-up, so more to come. Switching over to service requests and authorizations, some good feedback here. The first one is giving all the DSP supervisors and so forth the ability to see where the service requests are at in the process, right? You can get to the form, but we're going to give you basically a list of all of the service requests that you can open up, and it'll show you the timeline of events from when it started, when it got into your court, and then when it was handed off to CSS, the billing admin, or not billing admin, fiscal, and PRG. So that's going to be some nice functionality to just provide more insight, to give you more access to the data and the timeliness of how things are working. All right. Other than that, we're going to be giving billing admins the ability to see the total authorized amounts on the service authorizations. So more of the dollar amounts, the dollar figures that are going to be associated to those records. We're going to, by default, on the dashboard, filter out service authorizations that are in a pending closed view. You'll still be able to access them, right? You can still open them up, but by default, we're just going to show you approved service authorizations because, as you understand it, that's more so like the newer ones that have been generated, where you're more likely to be logging your time. A provider change on an SCR is something that we're looking into. And then lastly, there was, I think, a few requests around basically creating an acknowledgement only role where you can give this role out to any user in your organization, and they basically are the ones who are responsible for acknowledgements, right? It could be one person, it could be a team, but it's just a kind of a one-off role that you'll be able to give out to people. More so general functionality that we're going to be working on releasing. This one we've definitely heard a decent amount of times. It's basically making sure that the test system reflects production to some degree so that the data is a little bit more thorough. So we've definitely talked this through internally, and we've talked it through with South Dakota. We have a game plan. So we'll be looking to get that pushed out with the newest release of 3.4. Another one, program management, allowing provider agencies, you all, to manage your programs at locations, the users associated to those programs, and the services that they deliver. So more of that self-service functionality is going to be coming from the portals perspective. And then the last three bullets, updating a little bit more of the security on the provider portal, fine-tuning some of the role combinations that can be assigned out, getting email communication updated. So if you log a ticket, for instance, automatically sending you a notification that we received it. Or if a service request is denied for some reason, sending you an email that this is why it's denied, or stuff along those lines. And then lastly, just an overall update, some of the general navigation themes that we have, like breadcrumbs, windows that you have to like drill into as opposed to having just a pop-out window, right, for quicker access. That one likely needs to have stars next to it, to be honest, because I'll likely want to talk that through with a few of the CSP agencies and get your guys' feedback on that. Again, this is more so like a high-level list of like the top topics that we've kind of reviewed and heard from you all. It's definitely not like everything, but yeah, much more to come on this. And I'm not sure who's next.
I think I am next, but
Okay.
Eden, oh wait, I can advance now. Okay. Okay, so to kind of piggyback off of the things that Tyson was talking about, so those are some of the like he said, the kind of the highlights of what will be coming out in the next release, which largely encompasses the feedback that we've received so far. We do have additional feedback that was received during UAT back in October, and so over the past few months, we have kind of staged some of those out. And we need some additional feedback on several of those items as well, because, a conversation that we had several months ago, we logged an item, but we might not, we might just need some more clarification as to kind of what the vision of the person providing that feedback was. And if that is a a priority now, or if it's something that we would implement down the road. So as I mentioned earlier in the meeting, we do plan to have sort of a user group, a subcommittee of this steering group, to really meet with more frequently, who can provide us some concrete feedback and on the design ideas that RSM brings forward that we really think will work as solutions, so we can have that ongoing dialogue with the users. We will be sending out some invitations in the next several days, probably late this week or early next week. Again, we're kind of zeroing in on those people who attended UAT sessions, who are familiar with the system. Some people who have been live in the system already, and some who haven't, because we want a really well-rounded point perspective. So we will be, we're proposing that group comes together about every other week. We haven't established any dates or anything at this point, but that will give some time for the feedback loop to kind of continue along. So RSM and DDD can bring forward some of the design solutions that are proposed. The subcommittee can provide feedback on those solutions, and we can make adjustments and come back a couple weeks later and show results, etc. We will be having, so as we're talking about kind of the next release, what that means is basically there's a round of updates. So if you think about December 1st, when we went live with SCRs and some of the case note functionality, that was considered 3.0, right? And we've implemented several releases since then. So 3.2, 3.1, 3.2, 3.3. Those have all been kind of smaller releases, and we've done lunch and learns for each of those. Before we release 3.4 with this kind of larger package of functionality, we would bring this larger steering committee back together to kind of walk through each of those views and the solutions that have been brought forward and vetted by the subcommittee. So those are the intended next steps to keep our project moving forward. This is very important work, and it impacts every single person on this call and well beyond that. So we want to make sure that we are giving it our full attention and prioritizing your guys' requests. So with that, I would just say thank you. We wanted to provide a lot of information and follow-up today. I guess we have a little bit of time for questions, if there are any. The chat box has been rather quiet. Dan, I see your hand is raised.
Hello, yes, thank you. So a couple of things. You know, it looks like the RSM team has done a lot of work in other states and with all of this stuff, and that's great. I'm wondering, you know, is there any way, I mean, do you have a system that looks like this system that we're trying to build that we could at least kind of see and see how it operates at an optimal level? And are there things that can be transitioned to South Dakota as a way? Because really, one of the biggest problems that we're having is that when the system goes live, we're doing a lot of feedback, and we've had to create all of these side systems to operate on the side to make it work correctly, and we simply just don't have the time to do that anymore. And so I'm wondering if there's a way that these things can be built and then launched rather than building as we go. It's very difficult for us to do that. So I just was curious if there's a lot of questions, sorry.
Yeah, Dan, so this is Phil Hayes from RSM. Yeah, happy to address that. Yeah, I mean, we do have that available. And part of that has been, you know, what we've been working with the South Dakota team on already, is during the requirements gathering. What we try very hard to do is not to do requirements gathering without a screen up. So when we talk through a solution or talk through a process and say, you know, we understand your process is X, what we do is we actually have something up, and when we do that, it's almost always an example of what we're doing at another state or another system. So to that extent, we do have that, and there's a part of it that is, I think, where we have seen the similarities between South Dakota and other states, I believe we've been doing that a lot, but we're happy to show more in that area. There are some places that are really different between South Dakota and some other states. And so some of that pieces aren't relevant. We have a client that doesn't do prior authorizations. So the whole authorization process that you guys go through, they don't, because of the way they have contracts with their providers. And so there are things that we have, for example, that don't line up exactly, or that we've done in other states that we haven't done here yet, haven't done all the case management pieces, for example. So from this side, from the provider management and billing, absolutely happy to show those. We also have some examples where we've done it with agencies that aren't developmental disabilities or have a developmental disability and behavioral health as a part of a single agency with duly diagnosed. And so there are some variances in there that we've tried to take those best practices and combine them and bring them forward with the state. So we understand 100% on that. I think one of the challenges that you're seeing is the working through the consensus process, consensus for process. Part of it is trying to bring together multiple ways of doing it into a single way of doing it. I think that's a big challenge. We see that with a lot of clients. And I think that's a challenge it's just a challenge that we see. The real proof in the pudding is in user adoption is, after these things are up and running and we start to tweak them and get them better, is really where we start to see the benefits flush out in kind of continual improvement. The one piece we do often work with our clients is this idea that what you have is a living application. And so many times we see in state and local government and somewhat in commercial, but more in state and local government, where they've brought in a large system and it sits and sits and sits, and 20 years later they come to replace it and no one knows how the original system built, because they take it as a one-time thing that we implement this once in one way and we never touch it again. And so really the approach, we believe that's a flawed approach. South Dakota believes that's a flawed approach. Medicaid thinks that's a flawed approach. And really the idea is that the application should be living. We should always be working on it. We should always be tinkering on it. Now, the level of effort that we're using now to improve it and to get feedback is higher than it will be over time. But we anticipate that we will always be making this better. We will always be looking at the next technology advancement to figure out a way to have a computer system do what it needs to do and give back the individual more time so they can be in front of that family and that person in need. That's the ultimate goal. And so we really want to make sure that we do have a continual improvement. So we do want to set up that expectation that we're not going to go live one day with these pieces and then never work on it again. It really will be something we want to continue to work on from time to time and over time. I hope that
Thank you.
answered some of the pieces.
Yeah, I mean, I don't disagree with continual improvement. I think that's gotta be a piece of the puzzle. I think that my members, just speaking on their behalf, I think it would be great if we could see some kind of demonstration from other states that have a similar service system that's set up, how the system works, how it operates. And we certainly would need a focus on efficiency 100% going forward. So with that, I've got some other questions, and I don't know if those are things maybe you could take offline, or maybe that's a part of a future meeting or something along those lines.
I think we have a few more minutes.
So, back to like the case note, there's a lot of steps involved in that, and it feels very administratively burdensome. You have the DSP that enters the case note, you have the supervisor that checks the case note, and then you have an admin that then checks the billing part of that. I mean, are all those steps really necessary without, because what we were finding was that was really taking a lot of time. So I don't know if that's an example of the whole efficiency part of this. So I don't know if there's a change in that. Is there some kind of requirement for this kind of level of check? Is there a different way of looking at it? I don't know.
I can take that or start, and then Phil. When we walked through that, we talked about how that is required. There is a responsibility from CMS that the states have checks and balances and having internal controls like what we've talked through for the program or for the system reduces the risk of Medicaid misuse, right? And so those are the things that we have, all the things that are required. Those are the things that we have that we can't just automate at this point because those checks and balances are necessary. Phil, I know you went off mute, so anything that you would add or supplement?
Yeah, absolutely. And so those are some of the best practices that we see in applied in this sense to the Medicaid billing note that are best practices from accounting practices and fiscal liability and responsibility. So we often talk about this idea of separation of duty. You might hear SOD from time to time. And if you think about it, the person that creates the check can't sign the check, right? So you have it eliminates this ability to have a single path. We all, sure, growing up, all heard over and over from our English teachers that someone else should edit what you write. And so this idea of the check and balance is a part of the process that should always be there. It's part of the fiscal outline and responsibility from the GFOA, the accounting standards for government, state and local. And so putting those practices in place are what all of our clients do, every single one of them. We have those types of checks and balances in place. Some have more, some have depending on, and some have conditional ones. If it's over a certain amount or if it's up to here, it goes there. And so, but that idea of it is there. And so we're hoping that over time that burden will become less because of the process will become more normal. But those checks and balances are really the cornerstone that we look at for reducing the number of errors in it, and then B, preventing misuse of the Medicaid billing procedures. And so those are things we work really, really hard on. You may have heard other things like electronic visit verification. Those are additional tools that are added into some services by requirements to do the exact same thing. It's an electronic edit of that to verify. And so those are some of the standard practices that we see in every client and are part of the Medicaid regulations that we're adhering to, that were passed in legislature and things like that to within each state and jurisdiction to adhere to those accounting standards.
Thank you. I don't want to, it looks like some others might want to ask some questions. So thank you.
There is a question in the chat. Oh, sorry. I don't know.
Oh, no, I was going to quickly mention, just speaking of like the system that we've developed in the past, right? Our demo environment, where we have a lot of this functionality. During the initial discovery, we did loop in a few different case management agencies and CSPs to gather feedback on like how we've done it in the past for case note functionality, not just the form, but also the process. So there was a bit of that, but as we've gone through phase 3, new requirements have come up, new nice enhancements, like as things always do, good ideas are later mentioned and thought of, and we do our best to incorporate them into the system, right? So we've shown it before, but these ideas, that's just how projects go, right? New ideas tend to come up, new enhancements and all that. And sorry, Julie, to interrupt you.
Yeah, no problem. I was just going to say there is a question in the chat around, would it be possible to create a system that allows us to document for all services for the same person for the day within one page rather than having to click in and out of the authorizations for the same day? So I would just say that, so as part of the rate methodology work group, we designed specific services with specific service rates. And we did that based largely on provider feedback. And, I'll use community day and individual supported employment as examples. We heard loud and clear that those services in particular require a higher staff ratio and higher wages. And so the rates for those services are higher. But all of our services have different rates associated with them. If we were to document all services for the same person within one note, essentially, then that kind of bypasses the rate and fee schedule that we have designed as part of the fee for service structure. and would not guarantee that as providers, you would be paid adequately for the services you're providing as you're providing them and the resources that those require. I don't know,
Julie,
Joey, anyone else?
I
have
don't
anything
think
to add?
that's really what we're asking. The system itself, not that we would want to document everything all in one big case note, but when you can sort by the person. And then you go in and you enter maybe facility day. Once you've entered that, you're totally kicked out of the system. The sort is gone.
Sure.
And then you have to go back in, sort, go to the next one. It's just not user friendly
So,
at all.
Shirley, that is one of the views that Tyson mentioned when he was talking earlier, one of the views that we'll be creating. So users would be able to, Tyson, correct me if I get any of this wrong, but users would be able to navigate to the participant page and then create a case note based on the services authorized for that person. And that's directly based on your feedback, Shirley.
And not be kicked out for the next
Correct.
service.
You will just be brought back to, in theory, like what we're thinking is the participant record. So you'd find John Doe, open up his record, and to start, you'd see his profile, right? Like first name, last name, address, but there'd be 2 additional tabs, one for service authorizations, and then one for case notes. So you could see all service auths that tie to John Doe. And then the next tab, you'd see all the case notes for John Doe in basically sorting new to old, right? The most recently submitted notes. And from there, you'd be able to create new notes, save it, and you're still looking at John's record. And you could just quickly jump through those.
That sounds better.
Awesome. Thanks, Jared.
All right, we have just, oh, Dan, your hand is up.
Just one. I mean, I think that would be an example right there of like, is there an existing product out there that you already have that you can display to us? You know, there's got to be other states that have different ratios and different things for the various different services that they provide. Is there something that you already have that we can look at and view and those kinds of things? And then just one last comment. You know, I just want to make sure, you know, that what our providers really do need is something, they need more of a finished product that comes off the table before it's implemented. I think that that's the best way to go. And I certainly appreciate your guys' approach to, you know, the analogy of building a house and things like that. But if the components within that house don't work and you're forced to go out to eat all the time, then that's not going to work. And so I don't know if there's maybe a process that could be put into place to where the product is more finished before it gets rolled out or something like that. But I know that that is a chief concern for our association members. So I'll just leave it with that. I know we're running out of time. Thank you.
Okay,
Okay,
well,
go.
Go ahead, Joey.
I was just gonna say, thank you guys. I know we're right at the end of time and you saw for next steps. And so certainly we will be following up soon with those next steps. And again, appreciate you all coming together for an hour with us to kind of just get more of a sense of where we've been and where we're going with the project. And of course, talking about the expertise of RSM, who have been wonderful partners through this project. And so thank you all so much for joining us, and you will be hearing from us soon.
Great.
Thank you.
Thanks, everybody.
Thank you.
Bye.
Thanks, everyone. Have a good day.
Thank you.